Moment, every second minute, one Indian is dying of COVID, and to be able to counter this monumental challenge, the government going out of its way to mobilize resources. The Prime Minister met with the Chief of Defence Staff, extra military personnel brought into service, also the Indian Air Force, the Indian Railways, going all out in an effort to ensure that at the earliest possible the availability of basic facilities like oxygen supplies, enhancing the number of beds is taken care of, so that even if we can't immediately stem the flow of the virus, at least people have the bare minimum necessities required to be able to deal with the coronavirus.
Patients left untreated for hours. People struggling to find ICU beds. Oxygen, the first line of treatment against COVID, a luxury. Every minute, 2 people are succumbing to the deadly virus. The second wave of coronavirus has crippled India's healthcare system. As hospitals burst at the seams, every institution is being roped in to battle the surge in cases. From the armed forces to railways to industries, everyone is chipping in. Railways are running trains to stay desperate for oxygen. The Indian Air Force is airlifting empty oxygen tankers to filling stations across the country to boost oxygen supply. On Monday, Prime Minister Modi was briefed by the Chief of Defence Staff, General Bipin Rawat, on how the armed forces were helping out. The armed forces to have recalled all medical personnel who had retired in last 2 years to work in COVID facilities. The ITBP has set up a 500 oxygen bed hospital in Delhi. The DRDO has opened a 900-bed facility in Ahmedabad. It's a war-like situation as India recorded more than 22 lakh cases in a span of a week. COVID-19 is showing no signs of abating. The real test is in how medical attention can be reached to every person infected by the virus. Bureau Report, India Today.